So today I'm going to talk about an interesting case of a 64-year-old female referred for the management of a chronic wound that has developed in her right shoulder. So upon evaluation, when I asked her to open her shoulder so that I can evaluate the wound, what caught my attention was she had a very limited shoulder abduction. And when she was able to finally open her shoulder, I got my flashlight, and when I take a look at the area, I noticed that there was a cord extending from the armpit and goes extending to the antecubital fossa. So, fortunately for her, I'm not only a wound care specialist, but I also train in the areas of lymphedema. But today, my discussion is limited to this condition. We call it Axillary Web Syndrome, otherwise known as cording. So, by definition, what is AWS or Web Syndrome? It is a condition that may develop after interruption to the axillary lymphatics, such as during axillary lymph node dissection, sentinel lymph node dissection, trauma, or an obstruction from cancer. It is a visible or a palpable web to tissue that becomes taut when the shoulder is abducted. Location-wise, it is located, like in my patient, the patient that I've seen today, it's located in the axillary area, and it may extend to the antecubital fossa, and in some cases, it actually extends as far as the base of the thumb. So, we're going to talk about the pathophysiology of this condition. It has been indicated that it may be caused by a thrombosed superficial vein. The development is thought to be caused by an injury to the axilla, and that may result to axillary lymphatic dysfunction, and this can usually happen after a surgical intervention or trauma involving the axillary lymph nodes, as in the case of the patient that I had seen today. Now, it may be caused by obstruction from cancer, resulting to an interruption to the lymphovenous channels, resulting, or that may be result to thrombosis and stagnation of the lymphatic fluid. This will result in inflammation, fibrosis, and shortening of the tissue. Okay, in tissue biopsies, they reveal dilated lymphatics and also a fibrin clot. And those are the two features that usually seen in tissue biopsies in patients with this condition. So what are the typical features of cording or axillary web syndrome that usually seen in you're seen during evaluation? First of all, I would like to point out that in most cases, you don't see any clinical manifestation of cording days or weeks after surgery. However, in some cases, as early as few weeks post-op, the patient starts experiencing tingling or tightening and pain and whatnot, and sometimes a limitation of the range of motion. Patients may also display the affected arm, so when they come in for evaluation, sometimes the display the shoulder, affected shoulder is in protracted, internally rotated, and elbow flexed, with the wrist flexed and supinated, because it's painful to let the arm rest